The vaccine is the fastest ever to be developed, and Walgreens has been moving just as quickly to prepare for this historic day. Joining us now is Reena Shah, Walgreens Group Vice President of Pharmacy Operations and Services. Reena, it's great to have you here. What happens at Walgreens today?
Thank you so much for having me. I really appreciate the opportunity. We have been similar to how it's been for the last couple of months. We have been actively preparing for this moment for when vaccine is available. So we have all of our teams ready to go so that when vaccine does come to our locations, we can go ahead and activate our plans to support not only the healthcare workers this week, but really activating the long-term care facilities plan next week as we move forward.
But so just to be clear, when I think of Walgreens, I think of the general public, and it's my understanding that we aren't going to have access to this for months. Are you guys playing a role in the rollout to frontline workers?
So what we're doing right now, and you said it really well, in the fact that vaccine is limited as we speak right now. So the states and the federal government are working hand in hand to ensure that the allocated vaccine that is available, it goes to those recommended eligible individuals, healthcare workers, first-line workers. So what we've done is over the last couple of months, and even as we speak right now, we're working with states, working with healthcare institutions to offer our support to help immunize those healthcare workers. But shortly thereafter, starting next week, we will be activating the long-term care facility plan, which has been in partnership with OWS, Operation Warp Speed, as well as the CDC, so that we can immunize the residents at the long-term care facilities as well as the staff.
Okay, so that was going to answer my next question, which is, especially for a vaccine like this that has to be kept at super cold temperatures and has to be used within a few days once it's thawed, so to speak, why would you guys get some if you're not going to be giving it out for a couple of months? But you're saying Walgreens is going to play a role in vaccinating people at nursing homes and that kind of thing?
You're 100% right. So what we've done is we've identified locations across the country so that we can have ultra cold freezers as well as dry ice capabilities so we can store the vaccine. And what we'll be able to do is take that vaccine and go to these long-term care facilities, skilled nursing facilities, as well as assisted living facilities to help immunize those patients that we know are at highest risk. Our pharmacists, we have pharmacists across the country. We've been immunizing patients for over a decade, and we have a lot of experience of being able to take vaccine to go onto these facilities and help immunize those patients that need it the most.
At what point, what date, what time frame do you expect that people will be walking into Walgreens locations from the general public to be receiving this vaccine?
That's a great question. It's a hot topic across the board, as we spoke about earlier. And I guess even as the Pfizer CEO mentioned, we're continuing to build up vaccine inventory between Pfizer and Moderna and other manufacturers. As more and more vaccine becomes available, access to that vaccine will continue to grow. And so over the next couple of months, we anticipate that we'll be able to have our store similar to the flu season, that hopefully in the spring timeframe that we'd be able to have individuals come into our stores and get that vaccine when it's available to the general public.
Right. Yeah, I got my flu shot at the Walgreens in town this year. So basically, the best you can tell at this point is the springtime for everybody else.
That's right. That ultimately our first priority, based on ACIP recommendations, and the federal government and the states have done a really great job of, with the limited vaccine that is available, let's make sure we immunize those that are most at risk. And then as vaccine continues to build up in inventory, then we would continue to expand the groups. And so it is going to be a week by week process where we'll be monitoring and then making sure that as vaccine builds up, we'll continue to help support and help expand access through our locations when the timing is right.
Shepard Smith here. Thanks for watching CNBC on YouTube.